Disease X pandemic is a global epidemic that has caused an upheaval in the public health system. It has had a major impact on the lives of vulnerable populations, with many losing access to healthcare and other essentials. The transmission of disease X has included the spread of airborne and vector-borne pathogens, with the latter being particularly dangerous. The World Health Organization has declared the spread of disease X a pandemic, in order to control its severity and impact. Symptoms vary depending on the strain and severity of the disease, and can range from fever, fatigue, and severe respiratory illness. A wide range of public health risks are associated with disease X, including serious asthma-like symptoms and severe complications including death. Healthcare providers are under immense pressure to treat the volume of patients suffering from disease X, and to contain its spread. Many countries have implemented strict travel restrictions to and from disease X hotspots, in order to limit the risk of further contagion. Public health officials are urging the public to practice social distancing, good hygiene practices and other preventative measures to mitigate the risk of infection. Quarantine measures have been put in place around the world, to limit the potential exposure of disease X. Medical professionals have highlighted the importance of early detection, to reduce the spread of disease X and improve overall outcomes. In the absence of a vaccine, the most effective way to protect against disease X is to maintain good personal hygiene and sanitation. In some cases, disease X has caused long-term health problems, even when treated early and without complications. Medical research is ongoing in order to develop new treatments and preventative measures, to better respond to the disease X pandemic. Public health workers are dedicating every effort in order to prevent the further spread of disease X, and to keep the public safe. Vulnerable communities and disadvantaged populations are particularly at risk, and are receiving additional support and resources to protect them. Funding has been allocated to governments and health organizations for the rapid response, and to ramp up development activities. Risk mitigation strategies have been effectively employed to reduce the impact of disease X, but there is still more work to be done. Primary prevention measures focus on improving hygiene and sanitation measures, as well as reducing exposure to potential sources of contamination. Secondary prevention strategies focus on quickly identifying infected individuals, and providing them with appropriate medical care. Assessments of the public health infrastructure are necessary, in order to identify potential weaknesses and improve response times. Transparency and open communication regarding disease X is key in the worldwide response, as it allows reliable information to be shared among those affected. Non-governmental and philanthropic organizations are offering resources and assistance to countries affected by disease X, in order to minimize the impact in affected communities. Education and awareness campaigns are being directed towards the general public, regarding both prevention and protection against the disease X pandemic. Economic repercussions arise from the disease X pandemic, and global measures must be taken to ensure stability for those affected.